Tuesday, May 18th, and this is the Health, Hospital, and Social Services Committee of Metro Council. This evening we have 3 resolutions on our agenda. The first is Resolution RS 2021-940, Toombs and Taylor. This approves an agreement between the Safety Net Consortium of Middle Tennessee, LLC, and the Metro Board of Health to participate as a member organization in a newly created entity with governance, structure, and bylaws to more effectively further the work of the Safety Net Consortium to provide health services to the uninsured. Do I have a motion? We have been moved and seconded. Mr. Sharp, would you like to tell us a little something about this?
Its goal is to get people who are uninsured or underinsured access to the health care that they need. What they've done is formalize the governance structure and so forth. And the reason that this is here now is that it is now the leadership group is now a fee for membership, and it's $2,500 a year. And the health department will be on the governing board for this operation. So it's not just for Davidson County either. This thing it's for Middle Tennessee, or a large section of Middle Tennessee. They do fantastic work, and I'd encourage you to approve it. It's a good thing.
Thank you. Do we have any discussion? We have been properly moved and seconded. All in favor, say aye. Opposed? Any abstentions? Motion carried. Our second resolution is RS 2021-940, Toombs, Taylor, Welsh, and Swara. This accepts the Healthy Start Initiative Eliminating Racial Ethnic Disparities Grant from the U.S. Department of Health and Human Services to the Metro Board of Health to provide a variety of services in reducing infant mortality for pregnant and parenting women. Do I have a motion? We've been properly moved and seconded. Mr. Sharp.
5-year grants, roughly $5 million in total, where they target the areas of the city that have the highest infant mortality rate to try to improve those outcomes for those families.
Do we have any discussion? Seeing none, all those in favor say aye. Opposed, no. Any abstentions? Motion carries. We have one late filed resolution from Council Member Toombs, and she has filed a letter to approve. This is a resolution accepting a victim of crime grant from the Tennessee Department of Finance and Administration Office of Criminal Justice Programs to the Metropolitan Government, acting by and through the Metropolitan Action Commission, to increase access to services for victims often underserved within the community. Do I have a motion? We've been properly moved and seconded. Do we have someone from MAC who would like to speak as to why this was late filed and what this does?
Of May. We asked them to extend it so that we wouldn't have to late file. They refused the request for the extension. So because the effective date is May 20th, we had to late file so that it could come before council prior to the May 20th date that the contract is to begin. That's the reason for the late file. The funding is because we have an existing VOCA grant that's about $525,000. And because of the pandemic, it was difficult for us to do outreach to some of the young people that we were trying to engage with. And so these were additional dollars that we could apply for to assist with that outreach.
Do we have any discussion? Questions? Hearing none, all those in favor say aye. Opposed, no. Any abstentions? Motion carries. And with that, I believe we are adjourned. Thank you so much.